Thanks for staying with us. So to wrap up on our conversation earlier, we're going to read some tweets and then take Dr. Femi Ogunremi, who was a doctor in the United Kingdom and is back here in Nigeria. Good morning, sir. Are you there?
I'm here. Thank you.
Good morning. To have you on the show. I know you've been hearing our conversation and hearing what we were talking about earlier. Could you just share with us quickly your experience working in the UK, coming back to Nigeria, and why you think it's so difficult for Nigeria to begin to fix our medical system here?
Okay, so thank you for having me. I think when we look at the situation in Nigeria, comparing it to what happens in the UK, I think we have to look at the health system that we operate. I think that's the first place to start. The system is made up of so many things, and those things are like ingredients that will then determine the result we get. In the UK, things are well structured. If I see a patient, for instance, in the UK, and I leave this patient, I know that I can reasonably go home and sleep. I know that the next person that is going to see this patient, I trust their judgments. And so, but if I come to Nigeria, if I see somebody, I will still have my own concern about what's going to happen to this patient next. And that's where we look at the trust that we have in the system that we operate. So when there's no trust, you can't rely on things, and that leads to you looking for alternatives. So the system in Nigeria, where I'm not pointing an accusing finger at anyone in terms of maybe a profession or people who are delivering care. It's just that the system is a bit chaotic, and we're not getting the results that we actually need that can help us. If I go to the hospital, I'm expecting to be taken care of, and in the end, I want a result whereby I get well. But if I don't trust any part of the system to deliver that, then it becomes a major issue.
Okay, all right, sir. Let me ask you, who's responsible for creating a system that can be trusted? Whose responsibility is it? Is it the doctors, the nurses, the citizens, the government? Whose responsibility? Because we want a solution to our problems now.
Yes. You see, the truth is very hard. And if we do not say the truth, we don't get to the root of the problem. I won't say it's the doctor, the nurses, or the pharmacists, or whatever. I think it's the governance that will run. Leadership, especially the leadership of our healthcare, service. The leader is the one that has a vision. When we have no vision, we will lose it. If there's no vision, there's no direction. And the problem we have in Nigeria is our leaders, as harsh as it may sound, I think in majority of situations, we don't have a vision. We're just running in the jungle. And I think it's the bedrock of the problem we have. Let me cite an example. There is an hospital here in Lagos State that I think about 4 years ago, the leader of that hospital decided he was going to change this hospital from where it was to somewhere. He invited me. I went to that hospital. I remember my very first time. It's Federal Medical Center, Butemeta. It was the MD there when he was appointed. He called me and said, I want to turn this hospital to be like your hospital in the UK. And then I said, okay, it's all boiled down in the vision of the leader. That's your vision. Let's work it. And then today, if you go to FMC, Butemeta, I was part of the team that initiated the change in that hospital, to support his vision. I renovated the very first unit in that hospital. And that if you go to that hospital now, you think you're in the UK. I was proud when I went there about 2 weeks ago, and you see it. So what I'm trying to say is, when they have the vision to change things, you understand, then things will happen.
Yeah. Right.
So the final box lies on the desk of our leaders.
Thank you very much, Dr. Ogunremi. Unfortunately, we still have to bring you back at some point to help us discuss this issue further, but we have to move on right now this time. Thank you very much, Dr. Ogunremi, for joining us on the short notice.